Hello, everyone. It's Dr. Samantha Benjamin Allen, board certified in physical medicine and rehabilitation, here to talk to my folks who are trying to avoid a knee replacement. And this video will also include some tips for those who are preparing for one if you end up needing one. Now, as a physical medicine and rehabilitation doctor, I work very hard to help my patients avoid surgery. But certainly there are cases where it's necessary because the pain and debility from the arthritis that they're facing is just so severe that this is the next best option. So, why do people end up needing total knee replacements or getting them? The most common indication is severe arthritis, and it has to be in a circumstance where they have tried everything else and it has failed. So, this includes exercise therapy, weight loss modifications if necessary, injections to the knee, which usually are steroid injections or some supplements called, I don't want to put specific names out there, but they are basically like hyaluronic acid or some type of substance that adds to the synovial fluid to help cushion and lubricate the joint. And there are many different options for that, which is why I didn't give any specific names. But know that injections are an option. And then there are also medications, like pain medications, over the counters, as well as prescribed medications, or topical agents like aspirin, Bengay, diclofenac gel, amongst others. Now, what can you do to avoid a knee replacement if you're having pain from arthritis? Besides what I've already mentioned, you want to do exercises that are going to strengthen your quadriceps muscles, because your quadriceps are the muscles that help to offload the knee joint and take some of that pressure off. So these are exercises that involve you extending your knee or straightening your knee. So this can be leg raises, this can be squats. There are various machines that allow you to do this exercise, even a reclined bicycle. Now, the other thing you might use are devices like canes or walkers to help offload the joint. Just know if you use a cane, you need to put the cane on the opposite side of the knee that is causing you the discomfort or instability. And the common symptoms of arthritis from the knee include pain being number one. Two is instability. So feeling unsteady, like you might fall if you're going down the stairs, or like the knee is just buckling and not quite holding you, as well as crepitus, which is a word we use to describe this crunching sound that you hear or even feel when you bend your knee. Now, what to do if you get to a point where you need a knee replacement? How do you prepare for this? One is always asking the risk and the benefits, because your case might warrant some preparatory things that need to be done in order to make you fit for surgery. And this is where it's important to have a physical medicine and rehabilitation doctor on your case beforehand, because prehabilitation, which is basically doing the exercises necessary to strengthen your knee as much as possible before surgery, is what is going to help you be successful after surgery. So you want to have a prescribed therapy program in place before you actually get your surgery. And a lot of times this doesn't happen if you don't have a physical medicine and rehab doctor on your team beforehand. So think about this. And also, you want to make sure you go through all the clearance necessary to ensure that you are able to withstand the demands of surgery from a cardio or heart perspective and a pulmonary perspective, or your lungs. You want to make sure that you can withstand anesthesia and all that comes with that. So you will have a cardiac clearance, and you will also have testing of your blood to make sure there's no infections, any urinary tract infections either, because infections can complicate your surgery and put you at risk of having a poor outcome. So all that needs to be done before you get surgery. And I will leave you with a couple of tips in terms of how to move after you have surgery. If you do get a knee replacement, you do not want to cross your legs or sit in chairs or couches that are lower than your knee, or basically put you at too much of a flexion or bend in your knee. So if you're sitting on a surface that's so low that your knee is higher than your hip, you want to avoid doing that. So make sure you're sitting on surfaces that allow your knee to be at 90 degrees or like an L shape, so that you are not putting too much stress on your knee. You also want to obey all of the precautions that your surgeon gives you. You would benefit by putting pillows under your ankles or your calves, not below your knees, because you want to avoid getting a flexion contracture, which means your knee is stuck in a bent position and it's not able to extend. The goal is to be able to fully extend your knee and get enough flexion so that you can do stairs safely. And you want to be able to get at least 90 degrees of flexion in after a surgery. So you're going to endure some intense therapy to get you where you can bend and extend your knee sufficiently to be safe and mobilize well, because the goal of the surgery is to help restore the function of your knee. So what's the point if you cannot move adequately or safely afterwards? So some orthopedic surgeons will give you a CRM machine. This is continuous range of motion machine, or they might even give you a bike that you can use temporarily at your home. So talk to your doctor about what your post-surgery requirements will be, and also get an idea of how long you'll be out. And if you need a note for work, make sure you ask for that in advance, because that's often something that people forget. And it's a little bit of a headache trying to get all these pieces in order after the fact. So make sure you write down all your questions, and if there are any needs that need to be covered, like you're going to be out of work and you're going to need a note, make sure you ask for that up front. Okay? And I will leave it at that and just put some information in the comments with a little more about what this topic is related to. And if you are a person who is struggling after a knee surgery and experiencing severe debility in the home setting and would love to achieve increased mobility, independence, function, and quality of life, I invite you to book an appointment at freedomwellnessphysiatry.com, where you can work with a physician who's committed to seeing you thrive despite your circumstances. You can also call 240-339-5377, and I look forward to working with you in your journey to living better. Have a great day. See you next time. Bye-bye.